Hello, I'm Carolyn Jones. Welcome to this special edition of In the Black, Keys to Success, entitled How to Stay Healthy, Live Longer, and Cut Your Medical Costs. This presentation will focus on ways to practice preventive health care as well as how to set up a wellness program. We will demonstrate how to practice cancer care, first aid, oral hygiene, cardiovascular disease prevention, patient care, and nutritional awareness. All this plus much more on how to stay healthy, live longer, and cut your medical costs. The power to define how we want to look and feel is up to us. The power to choose our life's course comes from within. Don't relinquish that authority to anyone. Dentistry is a healing art concerned with the care and treatment of teeth as well as the surrounding tissue and bone structure of the oral cavity. Troy Adams gets you the facts on what you need to know about dental hygiene.
Dentists treat tooth and gum problems with a wide array of materials and techniques. The filling of cavities can be done almost painlessly, and high-speed drills and improved anesthetics make it possible to save teeth that may otherwise be lost. The primary cause of most dental disease and tooth loss is plaque. Plaque is a colorless layer that coats exposed tooth surfaces.
What would you do in case of a disaster? Would you be prepared to take appropriate steps? Jill Allison gets us some survival tips.
A disaster can strike quickly and without warning. It can force you to evacuate your neighborhood or confine you to your home. When it comes to disasters involving both individual and mass populations, the American Red Cross is the nation's foremost volunteer emergency services organization.
One of the most serious predicaments facing our nation is tuberculosis. An estimated 10 million Americans are infected with TB germs. Many of them should be treated, but most don't even know they're infected. Roz Miller-Sparks gets us some facts concerning tuberculosis.
Tuberculosis is spread through the air by those in the active stage of the disease, usually by close and prolonged contact. Many more have the germ in a dormant state and will never develop the disease.
Tuberculosis germs may spray into the air if a person with TB disease of the lungs or throat coughs, shouts, or sneezes.
Due to rising medical costs and the risks of developing major illnesses, it is essential that all of us reevaluate what foods we eat. Carla Edwards has a report on what should be included in any healthy diet.
Since taking charge of one's health has become a prime weapon against disease, there is now a growing awareness of the relationship between sustaining a nutritional diet and living a long and healthy life.
Over $1 billion a day is spent on health care in the United States, and every year millions of people die from major diseases due to their choice in lifestyles.
1 out of every 5 deaths in the United States is caused by cancer. Maria Trice-Jones has the story.
Anyone can get cancer, but most cases affect adults in midlife or older. About 85 million Americans now living will eventually have cancer. And the financial costs are also great, with an estimated annual cost of $104 billion.
Cancer is caused by both external factors such as chemicals, radiation, and viruses, as well as internal factors such as hormones, immune conditions, and inherited mutations. There are many types of cancer.
Every minute of every day, someone new joins the 14 million American men, women, and children with diabetes. While insulin allows those with insulin-dependent diabetes to survive, and oral medications might help those with non-insulin-dependent diabetes live with the disease, once diagnosed, diabetes does not go away. Jewel Allison has the report.
Diabetes and its complications can lead to heart and kidney diseases, amputation, and blindness. And if left untreated, diabetes can lead to death. Unfortunately, many people don't even know they have it. Diabetes is a disease that affects the way the body uses food.
According to leading healthcare advocates, medical consumers stand a 15 to 20% chance of being treated by an incompetent or impaired physician. Sarita Bianco has the story.
Medical negligence in this country costs thousands of people their lives each year, killing more than 80,000 patients and leaving hundreds of thousands seriously injured. The National Center for Patients' Rights is a non-profit advocacy group founded by victims of medical negligence, family members, and concerned friends.
What's the #1 killer in America, which strikes every 34 seconds, and what can we do about it? Carla Edwards-Garage has the answers.
Cardiovascular disease is the #1 killer in America. It claims almost as many lives as all other causes of death combined. Heart disease remains the nation's leading killer among men and women. 69 million Americans have one or more forms of cardiovascular disease.
Gary Null says what we have in this country is not a health care system, but a sickness maintenance system. What should be done to correct this predicament? Maria Trice Jones has the story.
Although the nation is experiencing a healthcare crisis, you can still lead a healthy, happy life if you follow well-defined strategies.
Gary Null is an award-winning journalist and best-selling author of over 50 books on health and nutrition and is the founder of the National Health Resource Council. Mr. Null believes you can live longer and healthier if you practice preventive health care by feeding your body only nutritional foods.
The lack of self-confidence in one's abilities can have a devastating effect on the physical, mental, and emotional well-being of an individual. Dr. Craig Polite, a noted psychologist, outlines a program of self-reaffirmation.
Try to understand how you or your actions contributed to some events working or some things not working. Right? It really requires that you stop, you take a look at your successes and your failures, and you try to understand how it happened and why it happened.
Alcoholism is a primary chronic disease with genetic, psychosocial, and environmental factors influencing its development. This disease is often progressive and fatal. Tri-Adams obtains for us some preventive as well as treatment measures.
Alcoholic beverages supply calories, but little or no nutrients. Drinking alcohol has no net benefits, but is linked with many health problems, as well as being the cause of many accidents, and can lead to addiction. The National Council on Alcoholism and Drug Dependence is a non-profit organization with nearly 200 affiliates.
Health insurance has become a major concern for those who are interested in controlling medical costs and obtaining affordable quality care. Maria Trice Jones has the story.
Going without health insurance could endanger your personal solvency as well as your life. A single bad illness could take away all you have worked for.
Your aim should be to insure you and your family against the most serious and financially disastrous losses that can result from an illness or accident. Obtain a policy that will cover major expenses and pay them to the maximum level.
Millions of Americans suffer from an allergic condition. For answers and strategies on combating this debilitating illness, Chachi Weska has the report.
For many people, allergies can be on par with a debilitating handicap, to the point where it can seriously interfere with one's work or social life.
An allergy is a situation in which an individual who's inherited the potential to be allergenic from their parents meets up with some foreign material in the air or in food, and as a result of this marriage of foreign material and the genetic inheritance, they develop the symptoms of an allergy.
A recent shift in public attention to AIDS has de-emphasized the dangers of non-AIDS sexually transmitted diseases, despite the fact that an estimated 12 million Americans acquire these infections each year at a cost of more than $4 billion annually. Troy Adams has the story.
Left untreated, non-AIDS sexually transmitted diseases can put Americans at risk for serious infections and complications, including infertility, blindness, neurologic damage, and cancer. Sexually transmitted diseases, STDs, sometimes called venereal diseases, VD, are infections you get from sexual contact with an infected person. Letters B, 300,000. The American Social Health Association is an 80-year-old non-profit organization dedicated to the prevention and control of all sexually acquired diseases.
We have a series of educational programs where we educate the public about the risks of sexually transmitted disease and how to protect themselves.
Often there are no signs or symptoms of STDs. A test from your doctor may be the only sure way to tell if you're infected.
Obstetrics is the branch of medical science concerned with the care of women during pregnancy, childbirth, and the period immediately thereafter. Maria Trice-Jones gets us some information on this important health area.
Pregnancy is a normal, natural process for most women, but a well-conceived preconception can help you better cope with the stress of pregnancy, labor, and delivery.
The importance of good prenatal care cannot be emphasized enough. A visit to your doctor as soon as you know you're pregnant is essential. This is particularly important for teens, women over 35 years of age, women with a pre-existing medical condition such as asthma or heart disease.
A newborn takes lots of work. This includes handling his or her physical, social, emotional, and language development. Maria Trice-Jones gets us some answers on how to take care of your baby.
Learning how to care for your newborn and his or her physical, emotional, and social needs are some of the most important duties of a parent.
Some of the things to do during the first 3 months of a child's life are: mothers should start breastfeeding if possible. Give small amounts of water as well as diluted juices that are added to the breast milk or formula. Don't overfeed. Make sure they have their proper immunization shots. Sponge bathe your child.
To prolong a healthier life and look great at any age requires that we practice preventive health care. This will also go a long way in helping to reduce escalating medical expenses. Carla Edwards has the report.
The rising cost of health care and the prospects of living longer make it imperative for all consumers to practice the lessons of prevention while maintaining a healthy relationship with their physician. When shopping for a physician, contact family, friends, hospitals, medical societies, and associations. Find a competent doctor when you're healthy and can afford to be choosy.
The following medical directory will complement your wellness program. Remember, to stay healthy requires perseverance, discipline, and a proactive attitude. I'm Carolyn Jones. Until next time, goodbye and good fortune.